you've got painful bladder syndrome. Ugh, such an ick. Painful bladder syndrome. Can you imagine if we started diagnosing that for people that can't get hard? You've just got limb dick syndrome. My apologies. Hi guys, welcome back to my channel. My name's Tilly, and in today's video I'm going to talk about anything to do with UTIs. So this is going to be a really long video. It's for people who have either never had a UTI before, or maybe you've had a UTI and you've been to the doctor and you've had some antibiotics but you're still not feeling well, and it's just, you're a bit confused and lost. This is the video for you. I'll timestamp it so you can zoom to the bits that are, important to you. So in today's video we'll talk about what is a UTI, how can we diagnose it, how can we test for it, and what the treatment is. As always, I have notes, so I'm looking down because I'm reading them. So I know an insane amount about UTIs because I myself have struggled with them. I had an infection for like 8 or 9 months. That was like the period of time in my life where I was really struggling. I had to figure it out on my own because doctors just don't really know what they're doing, sadly. I wish they did, but they don't. So that's how I know everything I know. I'm still not a doctor. I can't give you medical advice, but I can, however, educate you to everything that there is out there because we just don't know enough about them. So I'm going to categorize this into what is a UTI, what is an embedded or recurrent UTI, how are they diagnosed, so all the different types of tests that you can get done. And then I'm going to go into how you can treat them. So what is a UTI? Now I'm going off the UK NHS website definition, which I don't agree with, but let's see what they have to say. So it says urinary tract infections affect your urinary tract, including your bladder, cystitis, urethra, urethritis, or kidney infection. UTIs may be treated with antibiotics, but they're not always needed. Excuse me. In what moment in life do we say, oh, an infection with bacteria, let's just let that fester then and not treat it with, I don't know, something to clean it out with? But anyway, that's how the NHS view it. I disagree. And I prefer to go by the Mayo Clinic's definition, which is a urinary tract infection, UTI for short, is an infection in any part of the urinary system. So this includes the kidneys, the bladder, and the urethra. Most infections involve the lower urinary tract. So women are at greater risk of developing UTI than men are. That doesn't mean that men don't develop them. It's just easier for women to get them. And an infection is usually only limited to the bladder. It can be very painful and very annoying, and serious health problems can occur. So that's what it is. Now, within UTIs, you can get embedded or recurrent infections, 2 different things. So what do these things mean? Because again, complicated. We're not doctors. We shouldn't have to be our own doctors. So it's basically a UTI can become embedded or chronic when bacteria in the urine digs itself into your bladder, it buries itself into your skin cells there, and it makes itself a nice little cozy home, and you think it's gone. A few days, weeks go by, and boom, you think you've got another infection for no reason, when in actual fact it's just your bladder has shed a lining, and the bacteria is kind of out again and hurting you. So that's what an embedded infection is, and a recurrent infection is defined as repeated UTIs, which could be from the same bacteria strand or from a different bacteria, because that's the next thing. Just because a UTI is bacteria doesn't mean we all get the same bacteria. There's lots of different kinds of bacteria out there, some easier to treat than others. So a recurrent one is different infection. So you've treated it, or it's gone away, whatever you want to call it, and then for some reason, for months later, weeks later, years later, you get another one. That's a recurrent UTI. You're just prone to them, basically. So it's bacteria, basically. It's an infection in your body when you have to pee. What can that feel like? It can feel like burning. It can feel like razor blades. You've got to go more often. Even when you go, you're not peeing a lot. That's what a UTI is. That's what it feels like. You'll know if you've had it. You'll recognise the symptoms probably before any test can detect it. So that leads us to, how can we diagnose UTI? Now, this is complicated and controversial because there's so many different testing methods out there. Some are a lot more accurate than others, and the ones that are widely available, especially in the UK and on the NHS, are the ones that are the least accurate. So take what you will from that. So usually step 1 is a strip test or a dip test. This is the one where they dip a little stick into your pee and then they take it out, and depending on the colour on the stick they can determine if you've got bacteria or blood or leukocytes and all these other interesting things in your pee. I personally hate these tests because you can buy them yourself on Amazon or in the pharmacy, and they're fantastic for monitoring where you're at, but they should not rule out infection. They suck. They're just terrible. They miss out They're only reliable 30% of the time. That means they miss 70% of infections. Personally, I don't like those odds. Not for me. Next one is a urine culture. Again, this is available on the NHS, and that is what they'll offer you, depending on your strip test or dipstick test, which is stupid because we've just said it misses it 70% of the time. But you can still insist on getting a urine culture, and this is the one where you pee in a pot, they send it off to a lab, and they basically bake it for a few days and see what comes back, about what bacteria grows in it. Now, this one is slightly better. It only misses 50% of infections, so your odds are slightly better. So, don't negate it. It's still go for it. Now we're moving on to the better tests that are available privately, kind of in the UK and the US. These are expensive. I will link down below all the companies that offer them, but so they're not cheap, and they're not available at all on the NHS. The first one, please excuse me as I butcher these really long medically words, is the Polymerase chain reaction, also known as PCR. Now, this is a DNA-based testing method, which they use it to detect just UTIs. So it's very sensitive and specific method used to detect organisms, and it creates basically millions of copies of your DNA sequences, and then they test that against a list of bacteria that they've got. So this one only tests for certain types of bacteria, basically. So it can miss a few very weird bacteria that aren't very common, but it's still something that you should keep in mind, especially if you're willing to pay for it, because it's very expensive and it still might miss the type of bacteria that you have. Then you have next generation sequencing, also known as NGS. This one is super accurate because it means it's an umbrella term that covers different types of DNA-based technologies. Again, very tricky, don't understand. I just know that this one's slightly better than PCR because it utilizes what is called 16s and 18s, which refers to a gene common for all bacteria. 16s for bacteria and 18s for fungi. So basically it covers them all. Like if it detects this 18s and 16s, you've got a bacteria, they'll figure out which one it is. It's more comprehensive than PCR, so it's more global, it catches more things. But it's because it's not limited to a panel of organisms. So basically the PCR one, it's looking for a specific type of bacteria in a list. The other one is looking for a gene that's common to all bacteria, so they'll find it. Now the next one, this one is a little bit more, this is a little bit more affordable. I know I got this one myself and it was still expensive. It was £110, I believe it was. And this one is called a EQUC, which stands for Expanded Quantitative Urine Culture. It basically means it's like the one that the NHS offers, but just goes that one step further. Like they'll test it for longer, they'll change like the conditions in which the urine's kept, so that it encourages the bacteria to grow more, and they just take a lot more of a closer look at it. So that's what that one does, and this is the one that I would recommend because it's expensive, but it's still achievable. Like £110 isn't ridiculous. The other ones were into the hundreds and hundreds of pounds for the other ones. Okay, so that's all the testing methods that you can do. Now, how are UTIs treated? There's 3 treatment methods, essentially. One is antibiotics. So you should be taking full doses of these for an acute infection, which means if you've not got a complicated situation, like you've just got a UTI and, it's just come off on a Monday, you're at the doctor's by the Tuesday, you tested, the results by the end of the week, like that kind of thing. You should be taking 14 days of strong, full dose antibiotics. None of these 3-day courses that, is recommended. No. You need 14 days to kill the infection. Now, I know that sounds scary because a lot of people fear antimicrobial resistance, which is basically when a bacteria is resistant to antibiotics. Now, the only way that this can happen is if you let the bacteria come back. And the only way it's going to come back is if you don't kill it dead. So if you take 3 days of antibiotics, let's say, for a bacteria to die, but maybe it's not dead yet. Maybe there's just a few little bacteria left floating about that you feel symptom-free, you feel good, but, bacteria procreates at the speed of light. And then before you know it, 3 days after treatment, so you've done 3 days of antibiotics, you feel fine. 3 days later, boom, you feel like you've got UTI again. You've not got another UTI. You've got the same UTI that's not gone away, only this time the bacteria has learned how to fight the antibiotics. You don't want to do that. So just take full dose antibiotics, like long courses. And like I say this is like it's easy. This is the easy part, is learning it all. The hard part is finding a doctor willing to help you. Option 2, if you can't for whatever reason take antibiotics, because some people just cannot, their gut is just unable to take antibiotics, they've been on them for too long, don't worry, there's still an option out there for you, and that's called Hiprex, also known as, quite a long mouthful, as methenamine hippurate. Okay, long word. It's not an antibiotic. That's Hiprex's brand name. Methenamine. Oh my god, it's so hard to say. Methenamine hippurate is like the ingredient in the drug that makes it work. It's not an antibiotic. It's a urinary antiseptic. Think of it as bleach for your bladder. You take it and it basically makes your urine like bleach, essentially, because no bacteria would want to grow there, because it's not easy to live in an environment that's killing you constantly. So this one's good because it works for all bacteria types. It's just a lot slower because it's not attacking the bacteria, it's just making its home like not a nice place to live. And then option 3 is combining both. This one you do need to do it under medical supervision, because some antibiotics do not react well with Hiprex, like they can really hurt you, so you need to consult a doctor for that. Now, hopefully so far this video has made sense. I really hope it's helping. So that's it. We've gone through what is a UTI, how we can test for it / diagnose it, as well as how it can be treated. I will do a separate video on how to prevent UTIs, because that's a whole other genre. And I will link down below all the resources that I think are a fantastic help. And I really recommend that you join support groups, because they're full of information, and it's just amazing to not feel alone when you're not feeling well, because it can be quite scary, especially with an illness that it's not talked about enough. It's treated as if it's like a common cold. It's not. It's an infection. It hurts. It takes over you. I can't function when I've got a UTI. I'm bedbound. It's awful. There's nothing worse. So I really hope this video helped. If you've got any questions at all, please don't hesitate. Comment down below and I'll answer them. I'll probably know the answer. I am a fanatic. I know everything there is to know. If you like this video, please give it a thumbs up. I'd really appreciate it. And yeah, hope you guys have a great day. Bye. Someone in my house. I'm home alone though. Is someone fucking here? No.